Thanks for joining us today on Wellness Talk Radio. I'm Chris Costello, and it has been a difficult few weeks for many of us, and we appreciate you tuning in. We're going to be rebroadcasting today an interview we did a few years ago, and it is very prophetic as far as talking about a potential pandemic. And this is from Dr. Michael Osterholm, and he's one of the lead researchers, infectious diseases. And if you enjoy the rebroadcast, I'm wishing everyone the best and stay safe. And today we are talking with Dr. Michael Osterholm. Dr. Osterholm is a McKnight Presidential Endowed Chair in Public Health and the founding director of the Center for Infectious Disease Research at the University of Minnesota. An internationally renowned epidemiologist, he has been at the forefront of public health preparedness. Dr. Osterholm, thank you so much for joining us today.
Thank you.
So, you have written Deadliest Enemy, Our War Against Killer Germs. And your co-author is Mark Olshaker. And I wondered, how did you get together to write this book?
Well, Mark and I have actually been colleagues for many years. He wrote a book called Virus Hunters with Dr. C.J. Peters, a dear friend of mine, almost 20-some years ago. And Mark and I have been thinking about a book like this for some time. And as the issues just became more complex and the challenges greater, and frankly, the stakes higher, we decided it was time to do it. And so we got together, and in very short order, we had a number of publishing houses that were very interested in it. And so we set about writing the book.
You know, as we mentioned, the book is The Deadliest Enemy, Our War Against Killer Germs. And you've also been called the Paul Revere of Germ Warfare. And I'm wondering, how did you get that title?
Well, that was a very kind comment from the former Secretary of Health and Human Services, Mike Leavitt, who he and I have worked together for some time. And, you know, I have just spent 40-some years in this business in the trenches of infectious disease work around the world. Our group was very actively involved in the early days of Toxic Shock Syndrome, helping to define that problem and its relationship with tampons. We were one of the very first groups in the world to become actively involved in the public health response to HIV/AIDS. Even back then in the 1980s, we raised the issues around antibiotic resistance, what would happen. And so our group has really been on the forefront of predicting a number of these infectious disease issues that have come to play. More recently, more than 18 months before Zika virus arrived in the Americas, we had been warning that this was going to happen and the implications would be significant. We've been talking for some time about why Ebola infection was going to be changing in Africa because of the urbanization of Africa. It would no longer be a small outbreak, very rural village kind of disease, but it would be one that would be in the larger metropolitan areas and largely associated with some of the slum areas, and sure enough, that's what happened. So I think that, you know, we're not clairvoyant. We surely don't have a crystal ball. We just try to connect the dots of what's happened, where we're at now, and likely what's going to happen in the future. And that's really at the heart of this book, Deadliest Enemy, is really about trying to help us understand where we're headed with infectious diseases, but more importantly, what we can do about them. You know, one of the things that people often say when they hear about this is, oh, I don't want to hear this, it'll scare me to death. And our job is not to scare you out of your wits, but to scare you into your wits. And what citizens by themselves and together with their governments can do to reduce the risk of these problems, and there's a lot we can do, and we lay that out in the book also. We don't just present the problems, we also present the solutions. And,
you know, I have to be honest, I looked at it and I thought, this is going to be a lot to process. But as I was reading, I mean, there's so many interesting things that you have been involved with, and that, you know, one of the things you talk about is this whole concept should be one of our major priorities as a country.
Well, you know, it's interesting because while infectious diseases today are a global issue, there's no doubt about it. You know, we've eliminated oceans, mountain ranges, political boundaries, even big rivers and canyons from stopping the infectious disease movement. Last year, more than 1.5 billion people, that's with a B, went across international borders just as a tourist. Today, global trade and travel means that any infectious disease anywhere in the world can be in another part of the world the next day. And so we have to understand that that's a very critical part of protecting ourselves here in this country, is making sure that we deal with infectious diseases everywhere. And we've learned over and over again that, in fact, an infectious disease, particularly like pandemic influenza, a new strain of influenza emerging out of the bird population into humans, could literally bring the entire global economy to a screeching halt if we have these very high numbers of people sick and dying in countries all around the world at the same time. And nothing else can really do that. War doesn't do that. An asteroid hitting the Earth could possibly do some of that, but the chances of that are small. Even the risk of thermonuclear war isn't what this is. And so when you look at it, global climate change is the one thing that will affect the entire world, but it'll happen in a much more insidious manner. This is one that we have to be prepared for, and it's why recently people like even Bill Gates has written pieces in newspaper op-ed areas commenting on this very important issue and why we need to be better prepared, and we're not. And frankly, our track record in dealing with recent disease issues were not as such global pandemics, but looking at Ebola, looking at the Zika virus in the Americas, looking at diseases like yellow fever, another mosquito-transmitted disease that poses great risk right now in South America, we just don't respond well. And so what our book is really about is, first of all, defining the problem. How did we get here in a modern era, and what can we do about it? And I think that's what is the real important part, is the hope of what we can do about it. There's no beam me up Scotty machine technologies, nothing unrealistic. It's just our commitment to get it done and do it right.
Why do you think this hasn't been more in the forefront?
Well, we're very good at responding to crisis, generally speaking. We will take and throw every resource we have at it at any cost, doesn't matter. But we, as a society, and not just the United States, this is true for the world, we have a very poor time planning for things. I mean, to give you an example, we cite this in the book. Mark, my co-author, was interviewing the head of the Hurricane Center outside of Miami a number of years ago for another story that he was doing, and he actually asked Dr. Sheets, he said, what's the one thing that really scares you and keeps you up at night? And he said an F4 and F5 coming up the Gulf and running straight into New Orleans. Well, several years later, Katrina happened. And we were not any more prepared for Katrina several years later than the time that he interviewed Dr. Sheets. And we just don't get it about what really are the important critical things that can really do us in. And what do we do to prepare for them? We can't prepare for every eventuality. I mean, it would be impossible to do that. But what are those things that really have the most impact? And in infectious diseases, we actually break it down further. In our book, Deadliest, we talk about what is the difference between those things that really scare us, those things that concern us, those things that hurt us, versus those things that kill us. And many times those four categories are all very different. And so what we're trying to do is match up what really kills us, what can really affect the world, and what should concern us, not scare us in the sense that basically freezes us into inaction, but what moves us to take action and say, take these things off the chart. A good example, we should be completing the work on Ebola vaccine for Africa. It has stalled out largely since the outbreak occurred and the initial work was done. It's a very slow, long, laborious process right now to get licensed vaccines. But if we could vaccinate the healthcare workers, the burial team members, the emergency response people throughout most of Central Africa and Western Africa, we could do a great deal to make sure another big outbreak of Ebola never happens again. Why haven't we done that? And so what we do is raise those kinds of questions that are not often questions about scientific discovery or, some hope of a miracle, but it's just willingness to accept the fact that if we don't do this, these are the consequences of what are coming down the road.
It's kind of human nature. If it's not, we tend to think it's not going to happen to us.
Right. And, I think that, I've been in this business for 40-some years, and I'm at that stage in my career where I have to ask myself, why do I go to work every day? What drives me? And I can honestly say that I'm at that point where it's not about, trying to get more papers or more titles or more salary or anything like that. It's about, what does this mean to my kids and grandkids? There should be a lot of your listeners who have to be asking that same question. Think about us baby boomers. We're handing the world over to our kids in much worse shape than we got. In fact, worse shape than any other generation has ever handed it over to the next. And one of the issues that we could do so much to improve upon is these infectious disease issues. We need new vaccines. We need to have these plans in place to deal with these issues. We need to deal with antibiotic resistance. We're not that far off from a time where our kids and grandkids will be living in a post-antibiotic era, much like our grandparents and great-grandparents were born and raised in a pre-antibiotic era. Now think of the impact of that. And so this is we can't wait until this all happens and it's a severe crisis. We need to deal with it now. And so that's what drives me every day, is just to think about what will this mean for future generations. And what will we regret mightily we didn't do, we could have done and should have done. And this book is really all about that.
You're listening to Wellness Talk Radio. I'm Kristen Costello. You can find us at wellnesstalkradio.com. We're talking with Michael Osterholm, PhD, author of Deadliest Enemy, Our War Against Killer Germs. And Dr. Osterholm, one of the things you mentioned is our kids, what we're leaving for our kids, our grandkids. And you mentioned in the book about the microbiome. And you're saying that through our use of antibiotics, we're actually changing the microbiome, right? And some people don't even know what the microbiome is, so we should probably start there.
Yeah, well, first of all, we live in a world of microbes. It's a sea of microbes. We ourselves, our individuals, are a walking microbe factory. Very few people realize that there are more bacteria living in you or on you than there are total cells in your body. That those microbes, in many instances, are very, very critical to our survival. We couldn't digest our food. We couldn't absorb the necessary vitamins and nutrients that we need from our diet without these microbes. The certain kinds of bacteria that are on our skin, for example, help protect our skin against the kind of germs that can cause a serious problem. Even the hundreds of different kinds of bacteria that live in our mouth basically are critical to good oral health. But what has happened since our advent of using antibiotics, beginning back in the 1930s into the 40s, is the fact that we started to change that microbiome. And what's happening is you wipe out certain good bacteria when you're wiping out the bad bacteria. And that is an unfortunate consequence of using antibiotics. But if you need them so you don't die from a life-threatening infection, obviously it's a very good trade-off. What's happened, though, however, is we use so much antibiotic today, often unnecessarily, we are beginning to actually change the normal balance of what's inside of us. And if you look today at what you might find in rural tribesmen in the Amazon region and their native bacteria, it's very different than you see in the modern world. And so we can't really change that. I mean, it's a function of antibiotics being part of our world, but what we must change is the frequency with which we use antibiotics. Today, for most infections where antibiotics are given, they're not needed. They're either viral infections, which you'll recover anyway, and the treatment doesn't help, or they're infections for which the antibiotic really doesn't offer that much relief, and it surely isn't going to change your clinical outcome. Just that use of antibiotic alone has had a dramatic impact in genetically accelerating antibiotic resistance, meaning that you subject these bacteria to these antibiotics. Some of them develop mutations as they're reproducing, which basically make them not a target for those antibiotics. And that's a key issue. And then on top of it, we use many, many, many tons, thousands of tons of antibiotics around the world for raising farm animals. And in many instances, these are totally unnecessary and actually contribute also to a very rapidly growing antibiotic resistance problem in food animals, the bacteria that are on those carcasses that we then get to the grocery store and we eat, or around the world, right in the farmyards where these people live and work. And so combined with human and animal use, we have to have a new look at antibiotic resistance. So we still need antibiotics. They're critical. We don't want to go back to a pre-antibiotic era, but we've got to target its use. We've got to develop new antibiotics that hopefully will have more of a capability of not allowing the bacteria to become resistant, but those are going to be far and few between. And we need to develop vaccines for some of the diseases that we now are worried about with antibiotic use and whether or not they'll work. Certain kinds of pneumonia. We could vaccinate many people that would never get the disease for which they might otherwise die from an antibiotic-resistant strain of that particular bacteria. So all combined, this is a huge, huge issue, and I dread the day of thinking that our kids and grandkids will literally be in a post-antibiotic era back to what it was like when just common infections were reasons why people died. And today I might add that one of the real challenges with antibiotic resistance is actually in our hospitals, where we use lots of antibiotics, often way too much for what's really needed. And we then have patients who acquire antibiotic-resistant infections while in the hospital. Well, do you realize how many cancer patients today would die quickly if we didn't have antibiotics that worked against those infections? Or how many people couldn't get transplants or get implants, new knees, new hips, because it would be too dangerous without having antibiotics that work against the kinds of infections you pick up in a hospital? And so the whole world of modern medicine would be turned on its head if we don't change course here. And we can. And we lay out in the book a detailed plan for that. That's really an important consideration today that most people just kind of say, well, it's ways off. We don't have to worry about it.
But it's very prevalent already. It's everywhere.
It is. And this is one where, again, some of the infections are, I guess you would call, inconveniences. You know, there may be alternative drugs from what the primary drug is you would use, or they're not a situation where you would worry about this being a fatal infection. But we're seeing a growing number of infections where they are very potentially fatal and for which we don't have drugs. And that's just continuing to increase with time. So this, again, is on our crisis agenda in Deadliest Enemy. The same thing is true with influenza. Here's the disease that seasonally we tell you to get vaccinated with the 1940s vaccine, which is still better than not getting vaccinated, but it's very, very inefficient and ineffective largely against many of the flu strains for many different age groups. And if the next influenza pandemic were to start tomorrow, vaccine would have only very limited impact on the global spread of that pandemic influenza strain. We need new vaccines for influenza. We do very little that way. Last year, we spent over $1 billion researching new HIV vaccines, which I think is an important investment, should not be decreased. But we only spent $35 million globally on new flu vaccine research. And we believe that there are vaccines today that could be developed for influenza that could cover multiple strains that could protect you for many years and actually stop a pandemic before it ever starts, because these are the same strains that would be the ones that we would worry about with a new pandemic of influenza. Think if we could take influenza pandemics off the map. It would be just like, if not even more important than when we eradicated smallpox out of the world.
And now I've heard that some of the problem with the flu vaccines is like it is only effective against certain strains. So what do you say to people that, you know, they're hesitant about vaccines, that kind of thing? I know you have a lot to say about that.
Yeah, you know, again, the flu vaccine is not the ideal vaccine. It's largely very safe. But, you know, in a given year, if you get the flu vaccine, doesn't mean you're going to be protected. In some years, it may be down as low for some age groups as 0 to 30% protection. Surely better than zero itself if it's 30%. On other age groups, it may be as high as 50 to 60%, somewhere in that range. But these are not the kind of vaccines that can be produced quickly. First of all, they're grown in chicken eggs and take months and months to prepare. Second of all is the fact that they have this only in, best to say, marginal protection. And so I would still use them. It's very important that we prevent as many of these infections as we can with seasonal flu. But my big concern is the next influenza pandemic. What are we going to do when a new strain emerges that has the potential to kill 5, 10, or 20% of the people that get it? And modern medical care will not rescue us. We better have an influenza pandemic vaccine all ready to go, even if we're just trying to blunt the impact of the pandemic. Now, what if ideally we had a vaccine that we could have pre-deployed, meaning people would get it one time every 5 to 10 years and would protect against many strains, including the seasonal flu strains? Wouldn't that be a phenomenal gift to the world? And in this book, we lay out the plan for that and why it is realistic. Mind you, back in 1984, I caught a lot of heat from my colleagues because when the NIH announced that they had discovered the cause of HIV, and that then Secretary of Health and Human Services, Margaret Heckler, announced we'd have an effective AIDS vaccine in 2 to 3 years. And I was quoted in the media shortly thereafter saying, that's crazy. I don't think we'll have an effective HIV vaccine in my lifetime. And I still believe that that's a possibility. And this is all these years later. So this is the same guy now telling you, I do think we can have an effective influenza vaccine, and one that potentially could protect lots of people against lots of strains for a lot of time. So we need to invest in that. And that's, again, most citizens have no idea that that's a problem or why. And in the book, we lay out that.
And they don't remember that we did have that flu pandemic, right, back in the 1900s.
In 1918, between 100 million plus people died from pandemic influenza. And what they died from was largely the effect of the virus itself, not just the fact that they developed secondary bacterial pneumonias, which today we could treat better with antibiotics when they couldn't in 1918. So we wouldn't necessarily have a whole lot better outcome for the vast majority of the world's population today as we did in 1918. And the other impact of that is the fact that when pandemic influenza occurs, it virtually shuts down the world, because people in India and China and all around the world are also getting sick and dying. And we did a study several years ago where we surveyed a group of pharmacists around the world, experts in the delivery of drugs in all areas of medicine, and we said, what are those life-saving drugs you have to have every day or people die? Not cancer drugs, not designer lifestyle drugs, but what's on the crash cart in the emergency room? And we came up with 30 different drug categories for which it's critical we have these drugs every day or people die today. And all 30 of those are generic drugs. They're all made outside of the United States, most of them in India and China. There's no storage of those drugs at all. There's no warehouse of these drugs. It's just-in-time delivery. And if we had an influenza pandemic that would have a major impact on China and India, I can tell you right now there would be a lot of collateral deaths in the United States would occur because of the inability to get these drugs. Now, people haven't thought about that, and that's why the stakes are even higher for something like an influenza pandemic, why we have to make sure it doesn't happen. And so that's the kind of work that we talk about in this book, and we talk about how to get it done and why it needs to be done.
We're talking with Michael Osterholm, PhD, author of Deadliest Enemy, Our War Against Killer Germs. I'm Kristen Costello. You can find our website at wellnesstalkradio.com. And speaking of websites, where can people find you if they want to contact you or learn more about your work?
Yes, and we would encourage people to do that. Our center at the University of Minnesota, the Center for Infectious Disease Research and Policy, or was known as CIDRAP, CIDRAP, is actually, in a sense, the citizens organization that represents you at government and private sector kind of discussions. We're the ones that are trying to help empower this kind of science and policy marriage so that we get the work done that we need to get done. And if you want to get in touch with us, and I would urge anybody who has an interest in this topic, they can actually subscribe to our free daily mail service, which actually gives a news update every day of what's going on out there in language that's readable by all the citizens in the country. And that website is www.cidrap, CIDRAP, UMN.edu. So it's www.cidrap.umn.edu, and if you go there, you can sign up for the news, you can keep track of what we're doing. The website is updated daily, and hopefully this will give people more interest in information and what they can and should do. And I hope people consider reading the book, whether you get it at your library or wherever, just because it will give you a sense then of also why we need to do what we need to do and how we can do it. Again, our job is to scare people not out of their wits, but into their wits. And then Deadliest Enemy is all about that.
Yeah, it is, and it's an amazing read. I mean, there's a lot of things that I had never thought about before, and